Welcome everyone. Thank you for being here on our Transfer Tuesday mini-series. I'd like to quickly introduce Amy, Jordan, and myself to you. So Amy McKee is from UH Manoa, Transfer Specialist for the KEA program. Jordan Luton, who's a Leeward online counselor at Leeward as well. And I'm Laurie, one of the counselors at Leeward. We have a full agenda today, so I just want to get the ball rolling here. I did want to introduce our two speakers we're so fortunate to have today. We will be starting with our public health program, and Michelle Togorda will be starting, and then we'll transition to Solimar, who will share about the life sciences program at UH Manoa. As we share, if you have questions, you're welcome to put them in the chat. We will get to them, and also the Q&A if you want to also put it in there anonymously. I'll go ahead and transition to Amy as she'll speak a little bit about our beautiful UH Manoa.
Thanks, Laurie. So, welcome everybody, and we would like to say Walina Manoa. Just some quick facts about UH Manoa. It was founded in 1907 and is our flagship campus in the UH system. We are considered a land, sea, space, and sun grant institution. We are highly ranked Research 1 institution, NCAA Division I school, and we are striving towards being a native Hawaiian place of learning. UH Manoa offers over 100 bachelor's degrees for students to choose from. And so in this series, we like to just partner with some of our programs to share a little bit about the experience at Manoa. If you're thinking of transferring to UH Manoa within the next 1 to 2 years, we'd love for you to consider joining the KEA program. The KEA program is a partnership between UH Manoa and the community colleges, where students can receive proactive academic advising and other great benefits such as an application fee waiver, the option to take UH Manoa classes, and you get early registration when you start at Manoa. To be eligible to join the program, you do need to have at least 24 transferable credits, completed or in progress, at least a 2.0 GPA for our residents, and have at least one more semester remaining before you transfer to Manoa. I'll go ahead and drop our link into the chat so you can get some more information, but feel free to message me in the chat if you have more questions about the KEA program. Right. And without further ado, we'll turn it over to our first speaker today, Michelle Togorda with the Public Health Program.
Awesome. Thank you. So excited to be here today. Thank you to our organizers for hosting us. I appreciate having the opportunity to share a little bit about our public health program here at UH Manoa. So I just went ahead and shared my screen. So hopefully everyone can see that okay. So as Laurie had mentioned, yes, I'm Michelle Togorda. I'm an academic advisor with our Office of Public Health Studies. We are with the Thompson School of Social Work and Public Health. So it's a recent name change, but excited to be here to share a little bit about what public health is. And so public health really holds a special place in my heart since I'm an alumni of our program. And so I received my master's in public health from our department here. And so happy to share a little bit about the world of public health with you all. So I'll be going over some brief things about what is public health, some examples of public health in action, and also more information about our Bachelor's of Arts degree at UH Manoa. So what is public health? In public health, what we focus on is health promotion and disease prevention. And so we really look at what are the different ways we can keep our communities healthier for longer periods of time. So while doctors or nurses or other clinical professionals focus on those who are sick, they work on diagnosing and treating those individuals. Public health really looks at a more preventative perspective. What can we do to promote wellness and prevent people from getting sick in the first place? And so we really take that approach in how we work and serve our communities, where we look at programs that exist to be able to address different risky behaviors. We look at what we can do from a policy perspective to be able to increase health in our daily lives, and really looking at the strengths of our communities to really build off of those strengths to see what we can do to help promote health in our communities where people live, learn, work, and play. And so, public health is such a broad field. I want to spend some time going over some examples of public health in action. So, one example of public health in action is that we are currently, unfortunately, living during a pandemic. And so, public health really has come to the forefront in being able to address and monitor different infectious disease outbreaks. So, we have scientists, which we call epidemiologists, who study diseases working around the clock to understand the COVID-19 outbreak, not just here locally, but across the nation and across the world. And so these are folks that really look at understanding the disease and providing guidance to be able to take action to slow the spread and lessen its impact. And so this is one of our alumni of our program, Dr. Thomas Lee, who works with the coronavirus pandemic response in modeling and looking at predictions and understanding the rates of the disease in our different communities. When we look at providing guidance on, how we can slow the spread, public health really works closely within our State Department of Health to provide guidance of what we need to do to address these diseases. So looking at, preventing clusters of the pandemic by providing guidance of what we need to do in terms of minimizing get-togethers, close contact, or crowded gatherings. Another example of public health in action, public health promotes safe environments. So we really look at the built environment, again, where we live, learn, work, and play. These physical spaces really influence how our lifestyles are, which may or may not contribute to different chronic diseases. So public health works to ensure that there's investment in housing, in transportation, in crosswalks and sidewalks, and making sure that we have open spaces for us to be able to live in a community that's healthy and there's healthy opportunities for everyone. And so we think about how we can build our communities in a way that, again, allows us to be active, to connect with others, to be able to feel safe as well. Another example of public health in action is that public health promotes healthy behaviors. So scientists study how different individuals' relationships to their communities exist. And so we look at how we can focus on high-risk behaviors or trends in a specific population in order to improve our overall public health in the community. And so this is one example of how we're promoting drinking water instead. And so through this Rethink Your Drink campaign, we're really challenging the overconsumption of sugar sweetened beverages for us to, again, live healthier lives. Another way we look at addressing risky behaviors is through policy. So Hawaii became the first state in the nation to raise the sale of tobacco products to 21. And this was meant to be able to promote healthier lives for our youth and prevent this on the start of tobacco use later in life, because we know 18-year-olds were also high schoolers who would interact with those younger than them. And so by raising the age to 21, we try to delay the exposure of tobacco access in our youth. Another example, again, relevant to today, is that public health coordinates and implements interventions to reduce disease. And so this coordination effort right now with the rollout of vaccines across our communities is one real example of what we're doing to address and prevent different health issues amongst our communities. So I always like to provide a little bit of context of what public health is, because it's such a broad field and there's a lot that students can do in studying public health, and it's really finding what is the right fit for you in the public health field. And so I'll transition into more program specific information. And so with the Office of Public Health Studies, we offer different degrees that students can pursue. More recently is our undergraduate degree program, which began in 2014, where we began offering our Bachelor's of Arts in Public Health. And this is a national trend where many bachelor's degree programs began, and that was in response to the movement toward focusing more on preventative aspects within our communities. What can we do to prevent illness, prevent disease, really promote healthy lifestyles for us all? But what has been around for many years for us at the university is our master's program. And so students can pursue their master's in public health in specific specializations. So the master's is meant to be able to expand your scope of practice, to be able to focus in on a particular area in public health, whether that's epidemiology, so studying diseases. We have health policy and management, taking a look from a policy perspective of different health issues. And we have the nation's only Native Hawaiian and Indigenous health specialization. So looking at health from that perspective and that lens. And then our last specialization that we offer is our social and behavioral health sciences. So looking at theories related to behavior change. And so, there is lots of opportunities to study public health at UH Manoa. It is not required to have a bachelor's degree in public health before coming to the master's in public health. Many students come to public health at the master's level from different majors. So I'm happy to chat more about these different programs that if you're interested in the graduate level, studying public health at the graduate level. So let's talk about the bachelor's degree and what you'll gain by studying public health at UH Manoa. So of course, you'll have public health coursework. And through this coursework, you'll gain a nice foundational set of knowledge and skills that you could apply to a career in public health, or a different degree program, or to if you decide to go on to a different health profession. Public health is a great degree on its own, but it's a nice complement to also for folks who want to go on to different clinical careers. We have a lot of students pursuing public health at the undergraduate level and completing their prerequisites to go on to different health professions, whether that's medicine, pharmacy, physical therapy, and so forth. We also have an applied learning experience that's built into our major. And this is an opportunity where students get to really personalize their degree program by focusing on a public health interest that they have. And so this is great because as I tried to kind of illustrate how broad public health is, how there's so many different things that you could focus in on that's a public health issue. And so through this applied learning experience, students have that opportunity to get some field experience where they can work with a mentor, with an organization in the community who is working to address a public health issue that is of their interest. So how do you become a public health major? So the easiest way and most relevant for you all attending today's workshop, you can come to public health as a direct admit. So when applying to UH Manoa, you may declare the Bachelor's of Arts degree in public health as your major. And as long as you're accepted by UH Manoa and you picked public health as your major, you would come right in and be a public health student. We don't require any other application other than being able to get accepted to UH Manoa. Now, let's say you come to Manoa and decided on a different major, or you're not quite sure yet and you come to Manoa as an exploratory student. What we ask students to do first is complete our introduction to public health class. And so students that are transferring to our major from a different major, so are changing majors from a different major, they'll need to take our intro class first before they can declare public health as their major. And we want to just make sure students are aware of what public health is, want to make sure that it's a right fit for them. And so the intro class provides students a nice broad foundation of public health topics, public health careers, and helps you to decide again if public health is right for you. Once you complete the intro class with a B- or better, it's as simple as completing a major declaration form and meeting with me to go over what to expect as a public health student and what requirements you have to complete, as well as opportunities to get involved with our department and in the community. And then you come right in. So some of the things to look forward to as a public health major, there's skill sets, again, that we provide you. So being able to build on your quantitative skills, so being able to analyze data sets, being able to build on your social and behavioral skills. So thinking again about theories related to behavior change, and also your biological skills. So looking at public health biology and the different diseases that we address more currently regarding public health issues that exist currently today. Students get a nice understanding of public health issues in Hawaii as well as global health issues too. And so promoting our introductory to public health class is a great way to learn about public health. And at the very least, you will also fulfill a general education requirement. So our intro to public health class provides students with a diversification of social sciences requirement. And so let's talk a little bit about the applied learning experience. So that's that unique aspect of our major where students get to build their personalized project experience. And so it's a 3-course series where students first complete a structured literature review on a topic that they're interested in. And they use that to be the foundation of their field experience, where they get, again, linked up with a mentor, with an organization, and they complete 100 to 120 hours of research or service learning during 485 or Public Health 485. And then students wrap up their degree program with their capstone class in Public Health 489, where students will share more about what they've done through their research or service learning and provide some policy recommendations of what we can do to address the public health issue. So this is a great opportunity where students build their own perspectives on understanding of a public health issue. And again, because public health is so broad, it's a nice opportunity to become a mini expert in a particular area. And so when we talk about public health careers, there's quite a number of career students can go into, and these are some of the more common ones that our graduates have explored and wanted to compare from our bachelor's level as well as the master's level. And so at the bachelor's level, our graduates have worked as health educators, working on research projects as assistants, working with our nonprofit organizations as either program coordinators or program assistants, working with outreach in the community. And so public health is being mobilized again now more than ever as we address the pandemic. And so many of our graduates are working on the front lines and addressing different issues that we see in our community. And again, at the graduate level, students gain another set of skill sets and more specialized skill sets. And so students can work within our State Department of Health, work in academia, and working with also our local or federal organizations as well. So again, lots of opportunities to work in the field of public health or be able to use this as a way to help prepare you for different health careers. At the very least, public health provides you a nice foundational knowledge base of public health issues from a community perspective, and thinking about what can we do to keep our communities healthier for longer periods of time. So I'm happy to connect with folks if you have questions about public health, about our different programs, our different requirements, opportunities that exist also as students. So I am currently connecting students over Zoom. So Zoom appointments are definitely available. So happy to meet with you folks if you'd like more information about advising and how to get connected with me or schedule an appointment. I'll put the link into the chat box for you folks to visit, and also my email if you'd like to get in contact with me as well. Normally I have appointments with folks at in person before, and hopefully when the time comes again, but we're located in the Biomedical Sciences building at the upper side of campus at UH Manoa. But for now, I'm happy to meet with you virtually. Happy to take any questions. Again, mahalo for your time and me being able to share a little bit about public health and our program.
Great. So thank you, Michelle. That was awesome. That was such a nice overview, especially just to kind of get us grounded on like the context of what is public health. Because I think that's the question that I get a lot of times when advising students, and it's such a broad category umbrella where you could really go in so many different directions. So Yeah, that was great. So folks, if you guys have any questions, feel free to pop them in the chat or in the Q&A, and we'll get those to Michelle so she can answer your questions if you have any. Michelle, I did have a question. I get questions from students, again, who are looking at public admin and going the community health route through UH West Oahu. Can you kind of share any differences that you've noticed between maybe going towards that direction versus UH Manoa's public health?
Yeah, that's a great question. Thanks, Jordan. I know I get that a lot too, and when students are kind of deciding what options they have. So where we differ from UH West Oahu's public administration program is we don't focus a lot on the business aspect of healthcare and healthcare management at our undergraduate level. We students, as part of our completing our curriculum, have like electives that they're able to take, public health electives that they're able to take. And so if students want to try to build that into their major, then we try to work together and trying to identify what classes could satisfy our public health electives, but also lean toward more of a business kind of a management perspective in a healthcare setting. But I would say that's probably the biggest difference, is we don't have that as part of our focal point for our degree program versus what UH West Oahu has that as their strength in their public administration program. Mm-hmm.
Great, that's great, thank you. Looks like you're getting some questions in the chat if you want to take a look at those.
Sure. Yes. Thanks, Amy. So that's a great question about, and I can also talk a little bit more broadly about opportunities at the different community colleges. So, so the great thing about Kauai Community College is that's a partnership that began, I think, a few years ago, where their Kauai CC identified a need in their community to be able to have some sort of training for future, public health professionals in the pipeline. And so instructors of the public health courses that are being offered through Kauai CC really took it upon themselves to have that as training for their community. And so we partnered with them in sharing kind of our resources, our syllabus, and kind of our curriculum. And so yes, those are definitely a great way to pipeline into UH Manoa's program. Many of those courses have been built off of our courses being offered here at UH Manoa. So our intro core, the intro to public health issues in Hawaii, as well as global health. And so those three classes, I believe Kauai CC will be offering if they haven't already started. That was the goal for them to provide those three as a way to, again, have that training be implemented into their communities, but also accessible to many folks as well that want to get an exposure to public health. And so very transferable to UH Manoa's program. Mm-hmm. Very great question, Lori, about whether or not there are specialties within the Bachelor's of Arts and Public Health program. So although we don't have that built in as certain tracks, that's where I will work really closely with students to help pick certain public health electives if they want to have a focus in a particular public health area. So if a student comes and says, I really want to have a social behavioral kind of background, how can I, build toward that? And so I can recommend some public health electives that would help kind of do build their own specialization through those recommendations, and picking classes from the different social sciences, whether that's psychology or sociology, women's studies, depending on kind of where their focus is in on. So a lot of great conversations I can have with students to help make that happen, where we can build kind of a specialization utilizing their public health electives. Mm-hmm. And so for some specializations at the bachelor's level, we have some kind of the next step of a class. So we have, everyone has to take introduction to epidemiology, but for those that really like epi, we have advanced epidemiology that students can continue on in learning more if that area is of interest to them. So.
Thank you.
So Michelle, I'll just ask a question since other folks are maybe chatting or typing their questions in the chat. So if you're a community college student, is it ideal just to major as an associate in arts and liberal arts, kind of get the gen eds and then transfer, or kind of what do you see being the best route for students to take at the community college level if they're looking to transfer to public health in the future?
Yeah, that's a very good question. I think because public health is so broad, we get students coming from a lot of different areas and interests. And many times, if you are into the sciences, and have that as your background in the associate's degree, that helps. And we can talk about if that aligns with your interest in epidemiology. But if you're coming in from a general background, that's okay too, because I think a lot of our curriculum helps students build what they need in terms of their competencies through the classes that we provide and students will complete through the major. So I think it depends on kind of what their long-term goals are in terms of a career. So if you see yourself working in the like biostatistics or in epidemiology or in environmental health that might have a more emphasis on the sciences, that might be helpful to take and have that as a background. But it's not a requirement or it's not completely necessary, but we want to just see what we can do to help students in knowing kind of what their interests are starting off with us. Oh, so Amy asks another great question, if there are any student clubs or organizations that students can join in public health. So yes, we do. We have our Hui Ola Pono, so that's our public health student organization. And so we have our undergraduate chapter and as well as a graduate chapter. Graduate students have their own kind of, they hui together, and then the undergraduates kind of hui together also. And so that's something that, a lot of opportunities there in terms of service learning. So a lot of volunteer things that they work on, professional development, bringing guest speakers, also kind of working on fundraising and socials. And so they've gotten really creative during this pandemic of how they've been able to still find connection and working through this virtual environment. So, but yes, we do have student organization. And then our department works really closely with our Hawaii Public Health Association. So it's a local nonprofit that serves our public health community. And so we try to pipeline our graduates to be able to make those connections in the community as well through the Hawaii Public Health Association. Yes, I know they're very active. They're still very active. I think they just had their first meeting earlier this month. And so still garnering that interest from the students and building their membership too. So.
Michelle, just curious, how many in the undergraduate program?
Good question. So we average around about 160. I think that's around kind of where we currently have as far as our numbers. I think we dipped a little bit this semester. So I think currently we're at 152 when I last pulled the numbers. But our biggest class to date was 180 at one point. Yeah, total at one point across the different levels. Yeah. A big indicator of kind of whether there's an interest in public health is our intro class. And so when that class is quite full, we see a lot of students kind of transferring into public health. But we do have a minor in public health as well. So I figure I spend a little time kind of sharing a little bit about that. Our minor, we have about, I want to say 20 students currently minoring in public health too. And so students that might have found public health a little bit later in their journey and not able to commit to the full curriculum, but still want to get exposure to public health. We have a minor that allows students to be able to still get that under their belt.
Anybody else have questions? Let's see, I think we got to all the chat. Yeah.
Okay.
Great.
Michelle, is there anything else that you wanted to close with?
Oh, I'm happy to meet with folks, especially because again, public health is there's so many opportunities in kind of working in public health or studying. And so I'm happy to have a conversation and share a little bit about my experiences as well in the program. So feel free to reach out anytime if folks want to chat more about public health and public health at UH Manoa. So
Thank you. It's so helpful that you're a graduate, Michelle, so you know so much, about the classes, and I think it's exciting to see I don't know if exciting is the word, but definitely public health is in action. I mean, especially these past 13 months. But I think it would be a super critical topic. I would anticipate, more people at least taking the 101 or minoring in it, but it's all for the good. But thank you so much for being here, Michelle. You're welcome to stay as we transition to Solimar. But and those of you, if you do have other questions, you can put in the chat, and if Michelle is still here, she can address them. If not, we'll forward it to Michelle.
Yeah, thank you, students. Thank you, counselors and faculty who joined us today for our session. Our next Transfer Tuesday is going to be on March 2nd, and we're going to be having the art department joining us as well as the Academy for Creative Media. So if you love those two majors, feel free to join us next time. Solimar is also going to be back on April 13th for a session with SOIST and physical sciences. So if you're interested in those majors, please come back for that as well.
I actually will be having I'll be passing the torch on to some of the department chairs. So we'll be doing a
Okay.
rapid fire. Yeah. So I won't be here for
Gotcha.
the April, but we'll
Mhm.
have those other departments represented there.
Mhm. Gotcha. Okay. Thanks. I'll follow up with you for that, so we can schedule that. Yeah. If anybody has any additional questions, feel free to stay on the call. Otherwise, we hope you have a great rest of your day.